Our group study is entitled R.O.A.D to Recovery, Responding to the Opioid Abuse Dilemma. We're looking to start an intervention program for young adults in North Georgia focusing on the opioid abuse dilemma. But before we get into the study, we want to look at what are opioids exactly. So opioids are pain-relieving medications. They can be both naturally occurring or synthetic. Naturally occurring opioids are called opiates and are derived from the opium poppy plant. Some examples include morphine and heroin. Examples of synthetic opioids include oxycodone and Percocet. So how are these opioids used medically? Opioids are prescribed by doctors, in most cases to alleviate pain. Opioids can also be used for anesthetics, cough suppression, and bowel control. Some side effects can include drowsiness, lethargy, decreased breathing and heart rates, and sometimes even death. So how do opioids work in the brain? Opioids attach to receptors in your brain which trigger an enormous release of dopamine. This gives you a feeling of euphoria. As opioid use continues, the body's ability to release and respond to dopamine on its own is suppressed. So patients are prescribed these opioids to treat pain, and when they use this medication, not only are the patient's pain symptoms gone, but they feel better than ever before. Patients continue to chase this euphoric feeling, leading to increased use of opioids. Increased use of opioids leads to decreased ability of the body to release and respond to its own dopamine, and without dopamine, the patient is depressed and is willing to do anything to achieve that high. Once tolerance for these drugs increases in the patient, more and more opioids are needed to achieve the desired feeling. At low doses, opioids can cause lethargy, but as dosage increases, breathing rate and heart rate both decline drastically to a point that could be fatal. This is how medicine can turn into a deadly epidemic. So why are we choosing to focus on the opioid epidemic? There's so many other things out there to focus on. Why opioids? Every 12 minutes, someone in America dies from an opioid overdose. That's 115 opioid overdose deaths every day. Every day, 1,600 young adults misuse an opioid for the first time. 1.9 million Americans live with opioid dependence, and dependence on opioids can occur just after 5 days.
They gave me Vicodin after my knee surgery. They kept prescribing it, so I kept taking it. I didn't know it would be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
So as you can see, this is a serious epidemic that we need to handle as soon as possible. So our study is going to focus on young adults. But why did we choose young adults? Adolescent and young adults tend to engage in risky behavior such as impulsive drug use. And early use of prescription drugs lead to a greater drug dependence later in life. So we believe if we can stop this drug use at an early age, we can stop it from happening more down the road. 22.7% of young adults ages 18 to 20 use drugs, and at ages 21 to 25, that number is 21.5% still. These are astounding numbers that we need to get down immediately. So our study is also going to be focusing on the North Georgia region. Why did we decide North Georgia? So opioid abuse has the greatest effect on rural areas. This can be attributed to social, economic, and structural characteristics. The isolation and self-reliance of a rural area can negatively affect care-seeking behavior. Multiple barriers such as perceived stigma, cost of reassurance, of confidentiality, transportation, and availability of treatment centers can also be a huge hindrance in opioid abuse. So what's the rationale behind our study? First and foremost, it's to expand the knowledge and awareness of opioid use in society. We also want to improve treatment and intervention methods, to bring awareness to the malpractice of opioid prescription, to help identify the symptoms of opioid abuse among young adults ages 18 and 22, as well as to spark further research. So now we're going to look at our study exactly. So our intervention setting is going to be colleges and universities in the North Georgia region. Our target population is going to be young adults in that region, ages 18 to 22. But this isn't going to be strictly college students. It's going to be open to the whole community as well. We're going to be partnering with the North Georgia Department of Public Health and the North Georgia Drug Rehabilitation Centers in this study. The North Georgia Department of Public Health will be providing assistance in staffing our intervention, and the North Georgia Drug Rehabilitation Centers will be helping us keep an eye on our study participants. So what exactly are we going to be doing? We're going to be going onto these different college campuses, and we're going to be conducting the R.O.A.D to Recovery program. So this is going to consist of a 30-minute presentation as well as a 30-minute small group discussion at the conclusion of the presentation. We're going to host this intervention at a different college or university in the North Georgia region every week throughout the month of March. We're going to start at the University of North Georgia, followed by Young Harris College, Piedmont College, and finishing up with Covenant College. We're going to host the intervention daily, Monday through Friday, on the specified campus from 8 o'clock to 9 o'clock p.m. This will give all people in the area an opportunity to attend regardless of their schedule. So this is what the study is going to look like. We're going to be conducting a prospective cohort study. So on the day of the intervention, we're going to be passing out a survey to audience members containing questions about their individual opioid use and/or exposure. We're going to take data from that survey, and we're going to be comparing the baseline data from our program participants and the data from our program participants 1 year, 2 years, 3 years, 4 years, and 5 years after the intervention. We're going to be checking in with these participants once every year, emailing them the same survey, observing any differences, negative or positive. We will follow the participants for 5 years following the intervention. So our sample size is going to be dependent on the attendance of our presentations. We can't control that, but based on a p-value equal to 0.05 and 95% power, it would take a minimum of 950 participants to see any statistical difference. So this is the minimum number of participants that we're going to have. So how are we going to evaluate this? We're going to evaluate our intervention program by comparing the data we collect from our cohort at baseline, which is the day of the intervention, to the data we collect from the cohort 1 year, 2 years, 3 years, 4 years, and 5 years post-intervention. In order to measure the success of our outcome, we're going to compare the prevalence of opioid use in our cohort at baseline and the prevalence of opioid use in our cohort 5 years post-intervention. If the prevalence is significantly lower at an alpha level of 0.05 at the conclusion of the study than it was at the baseline, then we will consider our intervention a success. So how are we going to end this epidemic? First and foremost, we need to prevent new cases of opioid addiction. This is through education, outreach, prevention programs, etc., which is what we're implementing here. We also need to provide interventions and easily accessible treatment for those that do have an addiction, as well as push for legislation to prevent overprescribing of opioids, as well as black market availability of opioids. We believe that our study will do all of these things. Now here you can see the example of the opioid use questionnaire that we're going to be passing out to participants the day of the intervention and annually every year after the intervention. It includes questions about the patient's opioid use or abuse and exposure, as well as the contact information at the top. And then we actually have the example of the presentation we're going to be using in the R.O.A.D to Recovery program. So the 30-minute presentation, as you can see, it's a lot of the same information about what opioids are, how they work, how they can turn from medicine to dangerous, even deadly. Some facts on the opioid addiction, and then some specific to the state of Georgia. The drug addiction stigma that we need to get rid of, that drug addicts are junkies, low lives. Drug addiction can happen to anyone, even celebrities. Then just reiterating that drug addiction truth. And then also bringing up treatment options for people who might be struggling in the audience. And finally wrapping up with how we end the epidemic, and then a little video that you guys can watch on your own, testimony, a very powerful testimony that will be sure to strike home with our audience. And then obviously wrapping up with any questions the audience may have. And our references. And then, as we said, we're going to have a 30-minute small group discussion after the presentation is over. So they're going to be breaking up into groups of 10 and answering these following questions to help the audience members learn from each other and learn from each other's past experiences. I hope you guys have enjoyed our research proposal, and I hope you consider it greatly. Thank you.